lots of people are getting due for their booster. I had my booster earlier this week, and lots of people are coming up for their boosters. Why do we need boosters?
Look, it's an excellent question, and I will tell you, I was initially, I guess I was a little bit arrogant about my immune response because I thought I'm a younger individual-ish and I'm not in a risk group, so probably I'm not somebody who's really at need of a booster. However, all this data started coming out that immunity to this virus really did wane over time. So we're talking within 200 days or so. And what we see is that the immunity that the vaccine provides against infection, so this is symptomatic infection, not severe disease, actually really drops off and basically fades to zero after about 200 days. That's problematic because even though you're still pretty well protected against severe disease, you then are more likely to acquire the virus and transmit the virus than you were 6 months ago. So to me, the rationale for boosters is that it actually has a really profound impact on how the virus transmits in the community. And we've seen this play out overseas. We saw in Israel, they were getting large number of infections. The hospitalizations still stayed low, but they were getting infections coming up and they basically squashed that with the booster program. We see the same things happening in Singapore. And the data thus far looks like the booster really brings your immunity to symptomatic infection, again, symptomatic infection, back up to about 93, 94%, at least in the first 2 months post-booster. We don't know how long that's going to extend for because the data only goes to 2 months post-booster. So it's something we're watching carefully, but I would certainly recommend, consistent with the Target's advice, that anyone who's 6 months post their vaccination, even if they're a young, healthy adult with no underlying comorbidities, go get a booster.
And in some ways, this is more important. You're doing this a little bit for yourself, but you're mainly doing it for other people. You're mainly, doing it to protect your loved ones and
your children who aren't vaccinated, for example. Exactly.
Yep.
Right. I mean, look, if I got a COVID infection now, I'm confident that, whilst I might develop symptoms, it would be very, very mild because I'm fully vaccinated. But I would not want to spread that on to anyone else who might not be vaccinated for whatever reason.
So it's possible that this might become quite a regular vaccine that we could need sort of moving forward?
I don't know. So some vaccines, like the Hep B vaccine, 3-dose vaccines and you're done. There's, of course, some individuals who don't respond to that vaccine and then they need a top-up. But for most people, 3 doses and that's it. Some vaccines you need to give regular boosters. How regular that will be, if that's necessary, whether it's going to be different because we're sort of mixing and matching vaccines at the moment and that does boost immunity a little bit, I really don't know. And nobody knows. So that's got to be a space that we've got to watch. It's got to be something that we're willing to accept, that will just be guided by the scientific evidence.
Do you know if there's any sort of reported evidence around side effects at booster? Are people getting hit hard, or is it generally pretty much the same as what they had before?
It varies a lot. I haven't seen any data that points to one strong clinical consensus one way or the other. Certainly, I've heard anecdotally from clinicians that most people have a less severe response to their 3rd dose. I'm talking about Pfizer here. It's a bit different with different vaccines, to their 3rd dose of Pfizer versus their 2nd dose of Pfizer. But that's not true of everyone. I had a stronger response to my 3rd dose than I did my 2nd dose, whereas I had a colleague who had basically no response to the booster, but a very bad 2nd response. So I think it is just very, very variable.
and it may just be how you're traveling on that day when you get it, and how your body responds in an immune response.
Yeah, there's lots of variables involved.
Mm.